Hi, our group is the mortality analysis of the Central Valley of California. I'm Alicia Alonso.
My name is Jared Reese.
My name is Marco Aguilar.
And for our information of the mortality status in the Central Valley, we found that in 2011 and 2012, research showed that within the Central Valley zip code, there was a high rate of residents who were uninsured in healthcare. We found this was due to residents with social economic characteristics in geographic locations. And these Central Valley residents without healthcare had much higher rates of mortality, and if they did have healthcare, those rates would lower and also benefit doctors in their abilities to prevent certain outcomes. For our methods of researching the mortality rates in Central Valley, our research question was, what was the highest causes of death in the Central Valley from the years 2016 to 2017? And within our research, we found the data sources we could entrust were the CDC and the Fresno City Public Records to have the accurate numbers of deaths and causes of those deaths. And for our data analysis, our goal we hope to accomplish was to compare those different causes of death to the rates of death. And we used the deaths of Alzheimer's, cancers, chronic liver disease, diabetes, heart disease, and strokes within the different cities of the Central Valley. We used Bakersfield, Merced, and Fresno. And although Alzheimer's doesn't seem like a deadly disease, we chose it because research showed that patients who are diagnosed with Alzheimer's usually die within 5 years of it. Now to my partner, Jared Ruiz, with the graph.
All right, so what is the highest cause of death in the Central Valley from the years 2016 to 2018? For this first graph, we decided to do Bakersfield. So the x-axis represents the different types of deaths that we decided to research or find more evidence to. And on the y-axis, it shows the amount of deaths in Bakersfield. So the highest cause of death in the 3-year span, each color shows the different years. Blue represents 2016, red represents 2017, and then yellow or orange represents 2018. So the highest cause of death in Bakersfield for all 3 years was cancer. And cancer had a record-breaking 85 deaths in 2017. And then the close second was heart disease with 72 deaths in 2017. And then for the Fresno area, for the zip code 93722, heart disease was the first cause of death that was the highest, which research shows in the 3 years that we studied. Heart disease had approximately 102 deaths in 2017. And cancer was a close second, which for the years 2016 and 2018, it had approximately the same amount of deaths, which was 97. And for 2017 for cancer, it had approximately 78 deaths. For the Merced area, for the zip code 95340, evidence was relatively low in this area because you had heart disease, which was for 2016 approximately 101 deaths, and mostly than that, it's super low. And then I'll pass it on to my partner, Marco.
Okay, so overall of our research, we found some gaps which limited our research, and one gap that we actually found was the measurement of number of deaths, since people are constantly dying of different things, and there's a lot of variables that include with this, which include, depending on the counties, as you saw in the graphs, age groups, genders, and causes of death, because there are so many causes of death, and also the time span in which each research was done, since the death rate keeps changing all the time. So one research question that we actually had was, what are the top leading causes in death between 2017 and 2019 in Fresno County compared to the surrounding Central Valleys and counties. So one hypothesis that we actually had was that there will be no difference in death rates between Fresno County and its surroundings, since they're all basically in the same environment, which is in the Central Valley. So the discussion, some interpretations that can be made based on the results are the rate which people die. As we've seen, heart rates of heart diseases, they tend to be a lot higher since that's the most common disease. Also, this is significant into our results are very significant since we're able to compare death rates between different cities in the Central Valley of California. We can now focus our resources so that we could help the healthcare system in these various places. So now, why do we care about this? So we should care about these findings because this is where we as students can change the way we handle the healthcare system handles our health and so we could actually expand our family, friends, and neighbors' lifespan, since now that we know the fact or the roots of these death rates, we're able to now help the healthcare system. And these are our references. Thank you for listening to us.